All reporters. A few housekeeping items. First, just to note, this meeting is being recorded, so a heads up on that. And then all reporters are now on mute. To ask a question during the Q&A period, you can click the raise your hand button on the panel. We will announce your name and then unmute you. If we don't get to your question, don't worry. We'll show contact information at the end so you can follow up and reach out to the panelists. If you have any technical difficulties during the webinar, please use the chat feature to send questions to Lauren Vandam, and she'll assist you. With that, I will turn it over to John to get started. Thank you.
All right, good morning, everyone. Thank you. As Amy had mentioned, we're happy to take questions later and also happy to follow up after this call. So today we're going to talk about the elimination of the mandate penalty. And as everyone knows, the Tax Reform Act of 2017 eliminated these penalties, and many have described this as sort of the linchpin of the ACA. The natural question is what now, and really what is the likely impact? And from our perspective, a good way of thinking about the likely impact is really to think about two related questions. One is how many individuals might actually change their behavior, particularly in this case, not buy health insurance because the penalty is now no longer in existence. The mandate is still there, but the penalty is gone. And then the second question, which is a separate but related question, is what are the risk levels of those who might change their behavior versus would not change their behavior given the absence of the mandate penalty? And I think this second question is particularly important because it's really a question about what is the future spending of this group, and really and how this might affect premiums. And premiums might obviously have an impact on not only the budget, how much individuals have to pay, as well as the overall stability of the system. And one thing to keep in mind, and I think most of the folks in this call probably remember, is that fundamentally the role of insurance is to spread risk over a pool and therefore help a broad group of individuals deal with unexpected risks or usually high costs. And when we split the risk pool, it damages this risk-sharing function. So we wanted to address the question of what will happen. There have been a couple early reports that have come out, and most of these have all of these have really used simulation models where they've attempted to use the economic models where they estimate what might happen in particular situations. So those are really important tools, but they're fundamentally modeling exercises. In the literature on this topic, there's also a fair amount of controversy. There are some studies that suggest that there might be a modest impact, and there are others suggest that it would be really almost a negligible effect of eliminating the mandate penalty. The CBO and JCT had come out with an estimate of around a 10% increase in premiums and millions who might no longer be in the health insurance market, not just in the individual market, but across all segments. But ours is really the first to have real data, and really the first to ask Americans what would they do if the individual health insurance market did not exist. And in order to do this, what we did is we contacted a random sample of adults who were enrolled within individual insurance market plans within 2017. So these are folks who have purchased essentially an ACA-like plan, both offered through Covered California as well as outside of the exchange, these off-exchange plans that are common in many places. And we asked these individuals a series of questions. We wanted to understand how they were making choices and which choices they were making, et cetera. But also because even back then when we were designing this study and designing the survey instrument a year ago, there were inklings, particularly after the election, that the mandate or the mandate penalty itself was at risk. And so we included a series of questions around how well do people understand that there was a mandate and there was a mandate penalty, and how well do they understand, or rather, what would they do in the absence of this mandate penalty? So what we found, to summarize, is really the title. A quick summary is really the title of the blog, which is, we found that eliminating the mandate penalty would lead to harmful but non-lethal effects. And what we mean by that specifically, going back to our two original questions, is one, we believe that about 18% of current enrollees say they would not enroll had there not been a mandate penalty. And two, we found that, as one might expect, the people who leave or who choose not to buy in the absence of that mandate penalty are healthier than those who would stay. But more importantly, most stay. So the premium effect is much more modest. We estimate it's between 5 and 9% higher, and a point estimate is 7%. And as you can see by Exhibit 1, which should be available on both the blog as well as on your screen, the red bar corresponds to those individuals who say, amongst those enrollees, those actual enrollees in 2017, how many of you would not have purchased insurance had there not been a mandate penalty? And the red bars are highest amongst those in the lowest risk. So the first decile predicted spending, those are the people who appear to be the healthiest. Around 30% say they would not purchase insurance. And then amongst the highest group, the people who are likely to have the most medical need and the highest medical expenses, only 10% say they would not purchase. So obviously 30% is much larger than 10. But that's only part of the story. The other part of the story is the dominant part of each bar is blue. And those are individuals who say they would have purchased even in the absence of the mandate penalty. And there's also a small number of individuals who were not aware of the tax penalties entirely. And you can see those those light blue bars. And we believe those who believe that who were unaware of the mandate penalty and purchase insurance would likely continue to purchase insurance in the absence of the mandate penalty. In other words, they had other reasons for buying insurance, as many of these individuals did. And as you can see, the fraction of our sample that did not answer the question, the black bars that you can barely see, were very, very small. So I think this figure very nicely tells the story. The red bars are bigger on the left-hand side versus the right-hand side, but within each set of bars, each column of bars, if you will, there's more blue than red. So I think it's important that what we're trying to do here is really isolate the effect of eliminating the mandate penalty. And this is really asking the question of, in the absence of this one thing, what would you have done? I think a couple things to keep in mind. One is there's an inherent level of uncertainty to these estimates. On one hand, there's with all surveys, there's a certain potential for a social desirability bias where respondents might give answers that they think the interviewer might think is more appropriate or might be more socially appropriate. On the other hand, there are questions about inertia, where many studies, including our own, have found in the past that once folks start on a different path, they tend to stick with that path unless something major happens. And then I think the other issue is, this is obviously highly dependent on folks being aware that the mandate, one, exists, and hence it will affect their behavior, but even in the other way too. Many Americans might not know that the mandate penalty has been eliminated, and almost more importantly, they may not realize when the mandate penalty is being eliminated. It's really being eliminated for 2019. That means for the 2017 tax year and the 2018 tax year, so far the IRS says that it plans to enforce that penalty. That means come April, most Americans, when they file their taxes, they're going to have to show this year that they had signed up, and next year they're going to have to do the same thing, because for the 2018 year, the mandate penalty is still into effect. Also important is there are a number of other changes that could come down the road. We've already heard of a few that the administration is proposing. Those include the introduction of association health plans, short-term plans, et cetera. And these other changes have the potential for exacerbating some of these issues, either the number of people who might change their behavior or even the risk level of those things. For example, if premiums were to increase, we might expect that those folks it might influence whether people are likely to not purchase insurance, and also it might discourage others from signing up in the first place. Remember, our study focused on those people who already had insurance and would they keep it. We did not really address the question of, if you didn't have insurance yet and you're facing a premium level of X versus a higher X, what would you have done? And the final thing to keep it really in mind is that California, and when originally designed this particular study, was really, we viewed this as sort of a best case scenario. California has done an exceptional job of encouraging individuals to participate in health insurance, particularly in the individual health insurance market, and has done a relatively good job of balancing the risk pool. They've done a nice job of working around these, and they've done a wonderful job with outreach. And I think the outreach part is particularly valuable. And in some ways, one might think about this as the California model is sort of a prescription for survival for various states and other marketplaces in dealing with these changes, such as the elimination of the mandate penalty. So with that, I'm going to stop and hand it over to Peter.
Great. John, first of all, let me thank Dr. John Hsu and his team at Harvard for doing this work, and the California Healthcare Foundation for sponsoring it. So what this report finds is that the removal of the individual mandate penalty could result in about 380,000 fewer Californians with health insurance in the individual market, including approximately 250,000 who are currently insured through Covered California. The drop of those with insurance would be even greater because people would drop out of Medicaid, not because they pay a penalty, but because they wouldn't shop. And that was beyond the scope of this research, but it's important to note that there would be more uninsured than just the numbers that would drop coverage in the individual market. Now, while California would continue to have a stable individual market, and we have financial reserves and flexibility to adjust for this impact, the impacts will be real and significant for California's consumers. Californians will be paying increased premiums, and some of those who go without insurance will face big medical bills when unforeseen health events occur. Now, the consumers who decide to leave the market and go uninsured are rolling the dice, hoping they would remain healthy, but the fact is that many will lose that bet. We know that life can change in an instant, and illness and injury can be a moment away, and we don't know when. While we all think we won't be the ones that get sick or injured, the reality is that if 378,000 Californians decide to go without insurance, over 60,000 of them, 1 out of 6, are likely to need medical care that will cost them more than $10,000 in 2019. The real penalty is not what the IRS will collect through the coming year for being uninsured, but rather showing up at the hospital with no insurance and leaving with a massive debt. Now, in addition to having individuals that go without insurance being at risk, as John noted, there would be a less healthy consumer pool. Because of that, California's individual market would be facing premium increases in 2019 of from 12 to 16%, with the biggest single driver being the removal of the individual mandate. Increases at this level are bad news for consumers, but Californians will be in better shape than most of the nation. This study finds that 4 out of 5 Californians would opt to keep their coverage, even with the penalty going away. And here, we will once again be leaning in with a major marketing campaign to promote enrollment. The impact on other states, however, is likely to be far worse. The removal of the penalty in those states will be compounded by the absence of effective marketing and the prospect of new skimpy insurance products causing healthier individuals to leave the individual market. Premiums in many states could spike 30% in 2019 alone, with big increases in future years absent effective federal and state policies. Now, it's important to note that while consumers who receive financial help, whether in California or across the nation, would be shielded from those rate increases, the premium tax credits would increase and offset increases in premiums. Unsubsidized consumers would have no protections and would bear the brunt of these premium hikes. These are middle-class Americans, approximately 800,000 Californians, and about 6 million across the nation with median incomes of $75,000. They would be forced to pay the entire increase or risk being priced out of coverage. Now, it's so important to note that in addition to the removal of the individual mandate penalty, as John noted, there are a variety of other factors causing instability in individual markets across the nation, including cuts in marketing and outreach, which is not the case in California, and the prospect of short-term and limited duration plans that fail to protect consumers or provide meaningful coverage. Well, there is still time for policymakers to address these issues before we come to the crisis for millions of Americans in 2019. However, just as there's no single reason for the uncertainty and premium increases before us, there's no single solution. There are a range of options before policymakers to protect consumers and provide needed stability to health plans, including in particular federally supported reinsurance programs, increased investments in marketing, and other state-based solutions. Lawmakers should seriously consider these steps before we turn back the clock to a time when consumers face the inability to get coverage because they had pre-existing conditions, or bought what I call Swiss cheese coverage, meaning they thought they had coverage until the moment they sought to use their coverage and found out, whoops, sorry, there's a cap on that coverage or an exclusion. With that, again, I want to thank John and the team at Harvard and the California Healthcare Foundation for sponsoring this important work. On to Jeanette.
All right, thanks, Peter. Good morning, everyone. Thanks for having me. So the team asked me to speak a little bit about sort of the national implications of this research posted today. And I think Peter sort of set the stage for a couple of the things that I want to talk about. I think the research released certainly demonstrates that policymakers need to be concerned around the impact of the loss of the individual mandate starting in 2019. No, the report does conclude, as John mentioned, that the California market is going to be reasonably stable. I think we would agree that this may not be the case in other markets across the country. And I think it's important because you cannot look just at the loss of the individual mandate in a vacuum. We're very concerned about how the loss of the mandate sort of intersects with other policy changes that Peter spoke to a little bit, including this expanded availability of association health plans, the short-term limited duration insurance, and reduced enrollment trends in some states, and just rising medical trend overall. One of the things that we found very interesting in the release, and one would assume this to be the case, but it is confirmed in the survey results, that people that have lower medical costs or healthier people would be less likely to purchase insurance without a mandate. You know, we always sort of assume this, but these survey findings released today did confirm this. What's concerning to us are that these same people, these more healthy people, would be the same ones to gravitate towards these non-ACA plans, especially if they are unsubsidized, as Peter mentioned, and don't qualify for the premium tax credits. What's also interesting, and you have to consider in looking at this nationally, is that we really are witnessing a divergence of approaches across the country. We're going to see different regulatory and legislative strategies in more Democrat-leaning states and in more red states. And I think while some states are looking at putting in place their own state-based mandate or other policy options, other states are sort of heading in the opposite direction and looking at bringing back more of these short-term plans and other types of plans. But I think it's important from a timing perspective to note that now is the time for us to really think about how we can mitigate these potential increases in premium and what steps that we would like to see both Congress and states take to reduce prices for consumers for next year. Peter sort of mentioned a couple of these, but we think it's critical that Congress take steps as part of the omnibus legislation that they're considering right now to reduce premiums to sort of counter the loss of the mandate and promote greater affordability for consumers. Peter mentioned this, but I'll reiterate, one of the options that's critical is a federally funded premium reduction program, or reinsurance, as he mentioned. You know, we think this could reduce premiums between 8 and 12% in 2019, which is critical given what was projected in the results. We also would want to see long-term funding for the cost-sharing reduction program and other proposals related to the health insurance tax and just more flexibility for states. So this research sort of demonstrates one piece of why that legislation is so important, as well as other things that states will be considering over the next few months. It's important that consumers have access to this market if they don't get coverage through work or don't qualify for Medicare and Medicaid. And that's why sort of addressing these issues is so important for those consumers. Thank you.
All right, thank you to our speakers, and we will now go to the question and answer period. We're going to unmute all of our speakers, and for the reporters on the call, you should have a raise your hand button on your panel, and please feel free to use that now if you have a question. And don't be shy. Speakers, is there anything else that you might want to just, while we have a second here, to reiterate or add on to the comments you've already made?
This is Peter Lee, and I'm going to ask a question of John. It's one of the things that I noted is my understanding is this study looked only at the individual market and not about the potential impacts on the Medicaid enrollment. Can you speak to that and confirm if that is the case and sort of what the potential impacts might be on Medicaid programs?
That's a great question. So yes, you're correct. We did not look at the Medicaid group. And I think, but your question is also an excellent one because as you know, the Medicaid, we're talking about programs largely for those lower and moderate income Americans. And, the cutoffs for either obtaining subsidies or qualifying for Medicaid vary by state. And they can be in areas where it's very easy to cross that threshold in either direction because of some change in employment, an extra contract, etc. And so one issue is there's a lot of flux potentially going back and forth between the Medicaid programs and the individual insurance market, depending on how the economy is going or other things that are happening. The other issue is, others have described a sort of a woodworking effect where, the larger insurance efforts, including outreach, can have a tremendous effect on the entire population, independent of which segment they end up going into. Which is another way of saying, many of these individuals who are many Americans who are in the sort of lower moderate income range, it's hard to know, given what your modified adjusted gross income might be and whether you qualify for program A versus program B. And if you think that you might not, something might not be available or that you don't need to do something or there are other barriers in place, particularly for folks who have many other concerns that are there, because of employment or housing or et cetera, it can be very challenging. And so one concern that many have come up with, including the CBO, is that there will be a negative effect on the Medicaid market, that some of these individuals will decide that they don't necessarily have to sign up or they won't go through the process where they will end up signing up. And that's the other concern.
Okay, great. Thanks for that. And we are going to go ahead and unmute Sarah Hosseini. Sarah, go ahead.
Can you hear me?
We can.
Oh, okay. Hi. I was just wondering how much money will be spent on the advertising campaign for California.
I think I'll take that one. This is Peter Lee. For the most recent open enrollment period for 2018, we spent about $105 million on the full range of marketing, advertising, and outreach efforts supporting the agent community, community-based efforts, and navigator programs. We are right now reviewing our marketing budget for 2019. I would predict it would be similar we invest a lot in marketing. I would note that about half of our marketing spend is for paid advertising, TV, radio, digital. And we know that you need to reach out to consumers and talk to them again and again to nudge, push, cajole people to sign up. I would note that while we spend about $50 million on that paid advertising, the federal administration decided for 2018 to cut its spending on paid advertising from $100 million to $10 million. So to support the marketing and enrollment for the 36 federal marketplace states, the federal government is currently spending 1/5 of what California spends in our state alone. And I think that's a recipe for not reminding people about why health insurance is a good thing.
And if I could just add to that, I think one thing that California has done well is really highlight many of the good reasons for having health insurance. So the carrots, if you will. And there are many good reasons for having health insurance, such as, reducing your financial risk, improving your access to health care, et cetera. It's not just about the mandate, and it's not just about, complying with the law. And I think that issue of finding those things that resonate with individual consumers and individual Americans, I think is really important. And obviously those repeated efforts are very important.
Great. This is Anne again. I just wanted to also encourage people, if they have questions and they're having difficulties, they can also use the chat feature, and we will see those and can unmute you that way. And so again, just to give people maybe 5 or 10 seconds to use that option if they need it. Panelists, just any other points you would want to emphasize before we head to the end here?
Well, this is Peter. I will note, and I will note that this is the first time I have used Zoom, so people may be Zoom novices as well. But I would underscore one of the things that Jeanette noted is, and also what John noted, is that this study looked at one factor, which is asking individuals if the penalty went away, would they not buy? 18% in California likely would not buy. It did not ask them if your rates were going up 30% and there's no penalty, what would you do? And that's the prospect of many states around the nation for 2019 absent federal action. And so it's not a single factor, it's multiple factors. That is why the prospects of dramatic changes of the experience for consumers across the nation without subsidies is looming before us. The other thing I would note is Jeanette very rightly noted that local policy actions are going to be different. California has a history of having a administration and legislature that has very consumer protective policies in the health insurance domain. I think short-term policies are unlikely to be robust products in the state of California, but that's not the case in many other parts of the nation. And in those parts of the nation, you could see huge spikes in premium increases and huge uncertainty, leading health plans to say, why play in the individual market given this uncertainty when we've got certainty in the employer market and Medicare? It's just a market they don't want to play in. And that's going to be a huge risk, not in California, but I think in much of the nation. Jeanette, do you think that's a fair recap?
Exactly. I think that there are going to be very different approaches. We've already seen some bills looking at pre-existing conditions and what that means, et cetera. So definitely.
All right. Well, we have not gotten any other questions, but in case any of you want to follow up, there is my email on your screen. I can be reached. My name again is Anne Sunderland. My email is asunderland@chcf.org. Please reach out to me today if you want to follow up with any of our panelists to ask further questions. Hopefully we met your needs today on this call. I want to thank our panelists again for participating and all of you for joining us, and have a good rest of your day. Thanks, everyone.
Thanks very much.
Thank you.